Once on the football field and now in the medical field, Dr. John Frank, a former tight end with the San Francisco 49ers, is a Super Bowl champion. Now he applies his all-star approach to helping others with hair and scalp problems. Here to tell us his story and some of the latest advancements in hair loss therapy is Dr. John Frank of the Anapelli Hair Clinic. And for full disclosure, Dr. Frank is expecting a baby anytime soon, and I am his wife's physician. Dr. Frank, welcome.
Thank you, Dr. Moritz.
Well, now hold on a second. I didn't know about this Super Bowl business. So you play with the San Francisco 49ers, you get some rings. I thought you should open a car dealership. You go to medical school. How did that happen?
Just for that reason. I didn't want to be one of those guys who was suffered from injuries and didn't have a career after football. And my whole life's dream was to be a doctor. But fortunately, where I grew up, I was good enough, and I didn't have career-ending injuries, and I made it far enough in the NFL. And the time came to retire, and it was fortunately after a second Super Bowl championship.
Great. Now, I know you in the operating room because you're a really skilled surgeon. How did playing football, what can you say from playing football that you brought into the operating room that makes you such a great surgeon?
Well, I mean, whether it's organized team sports or even the military or other things where high science, there's an amount of sense of teamwork and camaraderie and discipline and hard work which lends itself to being a surgeon, I think.
Great. Now let's shift the focus to hair restoration, because it's a great topic. This morning I was in the gym and I saw one of the senators, I'm not going to mention the name, from New York that obviously had some type of hair surgery. Didn't look very good. What's changed, and tell me about your approach?
Well, this is the problem. Many of the techniques have evolved, and you see techniques from 10 or 15 or 20 years ago. They look like hair plugs, and it just is unsightly. And so much has changed, whether it's a surgical technique or non-surgical, and we've made so many improvements, whether it's for men or women and people from all different walks of life and all ages. There's been so many improvements, but the challenge is there are also a lot of false claims and misunderstandings and regret. So it's really important to get good information before doing anything.
Well, let's talk about your technique. I don't know the name of it, but why don't you tell us your technique? And I know that doctors travel from all over the world to come learn the technique. Why is yours better than the others out there?
Well, our technique is biocapillation, and it's a patented technique. But one of the most important, the basis of it is really making a good sound diagnosis. People can have hair loss, and there are products or surgeries or things that can be done which are one size fits all. What I do is really customized, so nobody gets a standardized treatment. It's really based on the diagnosis. And when it comes to hair and scalp, a dermatologist or any hair surgeon will let you know that there are many, many conditions which can lead to scalp problems and ultimately to hair loss. And getting to the root of the problem is really diagnosing what's happening at the scalp, whether it's inflammation or seborrhea or pooling. There's hundreds of different things, and if it's not correctly diagnosed, so you can be led down the wrong pathway for treating your hair.
Right. And when we think of hair restoration, we usually think about men, but as a gynecologist, I see a lot of women, especially after menopause, with hair thinning, and it's really distressing to them, distressing to their family. Do your techniques apply to them also?
Oh, absolutely. Look, for young men or middle-aged men, if you lose hair, there you can joke about it, and there's all different jokes about it. You can go anywhere, but for a woman, it can be devastating. And there are really two peaks of time in a woman's life: in her early 20s and then around menopause. And during the menopause, as you would know, the hormones are changing, and it can really have a profound effect on women and their hair. And there are many other conditions which can contribute to hair loss in women, whether it's a thyroid condition or anemia or a malabsorption problem. And for a woman, it's a devastating problem. It can cause psychological and emotional problems, and it can really be a real challenge. And it's something that we do a lot of research in, and we focus on, and we've had a lot of success in.
Great, Dr. Frank. That's all the time we have. Thanks for joining us today.
Thank you.